Good evening, everyone. I'm Twyla Dillian, Executive Director at HealthConnect One. Thank you for joining us at Birthing Hope, HealthConnect One's 2021 virtual fundraiser. What do we mean when we say Birthing Hope? The last 18 months have felt both like an eternity and a flash. We've lived through the loss and despair of the COVID-19 pandemic while simultaneously navigating a racial reckoning spurred by a recorded stream of violence inflicted on Black and Brown people. Throughout all of this, new lives have begun. Beautiful new babies have been born, and in each of these births, the hope of new life, new joy, new love, new experiences, a brighter future. Something beautiful to extend beyond our current experience. As these new lives are full of hope, so is the promise of support, knowledge, and guidance that our programs bring to communities. With each new program, there is a promise that mothers who are often dismissed at arrival due to institutional racism and a broken system will have a guide to help them safely navigate their birthing journey. At HealthConnect One, we know how crucial community-based doulas, breastfeeding peer counselors, and community health workers are to birthing hope in Black, Brown, and Indigenous communities. During the last 18 months, our team shifted to virtually support 7 new partners and our existing partner sites to ensure that families had the support that they needed while welcoming their new babies. We also provided advocacy support, sharing the stories of families and birth workers navigating the pandemic to understand what they were experiencing to share back through the Birthing Families Need Your Support storybook. The new presidential administration has also ushered in many positive changes for Black, Brown, and Indigenous maternal child health outcomes. A long overdue emphasis has been placed where the energy is needed most, supporting Black women, birthing people, babies, and families who experience the worst birth outcomes in the nation. This emphasis includes Medicaid and private insurance coverage of doulas, sustainability that is long overdue for doulas and doula programs serving our communities. Unfortunately, there are not enough community-based, culturally reflective doulas in the communities where the need is the greatest. HealthConnect One is committed to making sure that as doula reimbursement expands, there are community-based, culturally reflective doulas available to the communities who need them most, and we are counting on you and your generous donations to support the development of these programs. Additionally, we would like to express our thanks for Jaretha McKinley's 30-plus years of work and development at HealthConnect One. The organization and our partners are grateful for all that she has done, and we look forward to ongoing partnership now that she has transitioned from her role here. Thank you, Jaretha, for helping to build the HealthConnect One model and guide countless partners on their journeys. Let's hear from one of our partners that Jerry was instrumental in guiding. Black Mothers Breastfeeding Association. They have a breastfeeding peer counselor program and a community-based doula program in place.
Thank you for the introduction. Black Mothers Breastfeeding Association's mission is to reduce racial inequities in breastfeeding support for Black families. We do that through training, education, direct service, and advocacy. And we're happy that our partnership with HealthConnect One allows us to build upon that training portfolio, to build upon that direct service portfolio. We have been in partnership with HealthConnect One since 2013. I remember when we did our Train the Trainers training for community-based doula program and community-based breastfeeding peer counselor program. It was such an amazing experience. I had no idea that years later in 2021, we would still be in partnership and building upon the knowledge that we gained at that time. Through training from HealthConnect One, our community-based doula program is a nationally accredited home visiting service that connects pregnant mothers of Detroit with a community birth worker. In 2020, during the pandemic, we had 51 babies born into our doula program. Our community-based doulas conducted 668 virtual contacts and home visits, all of which wouldn't be possible without the support of Health Connect One, who continues to ensure that our programs are appropriately equipped with the knowledge and skills to support our families during this critical time.
I just always had such a great experience, and it's been such a warm support for my family and my breastfeeding journey. Most recently, I participated in the doula program with my doula being Robina Hill. Robina went above and beyond to support me. Although I'm a third-time mom, she always supported me by sharing helpful tips, baby milestones, and other just helpful pregnancy educational awareness tips that was very, very supportive for me. As many of you know, if you have been pregnant before, each pregnancy is different. Robina was able to support me with a natural childbirth support, and she also gave me different education that will allow me to actually have a home birth that I wanted to. She, brought me over a pregnancy ball, shared tips about how to breathe during natural childbirth, and really just truly encouraged me by being a sister friend. I highly recommend the program, and I highly recommend Robina personally as a doula. Thank you.
I'm happy to welcome Senator Richard Durbin of Illinois to present the award in his name in honor of an exemplary community health worker.
Thanks for inviting me to speak at your annual Every Baby, Our Baby event. I'm happy to join in making this occasion and recognizing the amazing work of community health workers across the nation. In addition to singing the praises of all community health workers who do the hard work of getting out in the community and meeting people where they are, I want to give a special shout out to the community-based doulas. Earlier this month, I was proud to lead a bipartisan resolution that passed the Senate. In addition to marking the week of May 9th as Doula Week, my resolution ensured that the Senate recognized the role that doulas play in promoting healthy birth outcomes for moms and babies, especially moms and babies of color. As you all know too well, the United States is one of only 13 countries in the world where the maternal mortality rates are worse now than they were 25 years ago. We lose approximately 700 women every year to pregnancy-related issues. 60% of those deaths can be prevented. African American, Hispanic women, they're particularly at risk, 3 times more likely than white women to die as a result of pregnancy. That's where doulas come into play. They provide pregnant and postpartum women with the support and information they need to better achieve healthy birth outcomes. This support is especially critical in communities of color where all too often women are discriminated against or ignored when it comes to health care. This past year has been tough on all of us, but no one more so than our healthcare workforce. That's all of you. Thanks for putting the health and safety of others first in your life. What you do each and every single day is heroic. I'm proud to play a role in recognizing your hard work and dedication.
I am highly honored to receive the 2021 Durbin Community Health Worker of the Year Award from HealthConnect One. I am grateful for the recognition I have received for my work. When I received the email stating that I was the award recipient, I thought, wow, really? Me? When you are out in the community, doing the work that you enjoy doing and connecting with residents, it doesn't feel like you should be awarded. But I must admit, it feels great to be recognized. I was introduced to HealthConnect One through the Closing the Gap project. Closing the Gap was a 3-year initiative to reduce the Black-white gap in infant mortality. At the time, in Inglewood, West Inglewood, Auburn Gresham, and Austin, African American babies were 13 times more likely to die of sudden infant death syndrome than white babies, and twice as likely to be born prematurely. HealthConnect One provided us peer educators with the tools and training needed in our growth and education. They cover topics from domestic violence, maternal mortality, SIDS, smoking cessation, and breastfeeding support, just to name a few. The trainings were held weekly, and it was nice that we could share our input and ideas from the field. This training allowed me to enhance my work as a community advocate and lead me to become a better champion in my community. On another note, we also have women of color experiencing maternal mortality and maternal morbidity. This means we have moms that are dying from giving birth or experiencing extreme complications after birth. And I am also working to improve these rates. At EverThrive, Illinois, we believe all infants and moms in our state should have positive health outcomes that are not determined or impacted by their race or ethnicity. Additionally, every family, regardless of insurance status, deserves high-quality health care. And I know that my work has had an impact on improving the health of women and children across the state of Illinois. Again, I thank you, and what an honor.
Hello, my name is Myrita Smiltars, and I'm the board chair of HealthConnect One. Thank you so much for attending our virtual event, Birthing Hope. This engaging and inspiring event showcased just a sliver of the awe-inspiring work that HealthConnect One and its partners are doing every day around the country to address inequalities in maternal and child health. I've been a supporter of HealthConnect One since 2007. The mission to provide an equitable start to life for babies and families has always spoken to me. 18 months ago, I had my daughter, and the mission has taken on even new meaning, both to me as a new mom and for my daughter, who is biracial. I understand that the work is more urgent and necessary than ever, and I ask you to please join me in making a contribution to HealthConnect One so that we can continue our work fighting maternal and child health inequalities in Black, Brown, and Indigenous communities. Any amount that you can give is impactful. HealthConnect One is a small nonprofit, and your donation will go directly to our programs and to support the communities that we serve. From the bottom of my heart, I thank you so much for any donation you are able to make to our organization. I thank you for your interest in the work of HealthConnect One, and I hope that we will have you as a supporter of HealthConnect One for years to come. Thank you. Take care and be well.
I'm pleased to welcome Denise Del Isola and Joanna Lowen of Irving Harris Foundation to present the Irving Harris Advocacy Award.
Hello, and congratulations to HealthConnect One on their 2021 Birthing Hope annual event. My name is Denise Castillo de Isola with the Irving Harris Foundation, and I'm honored to be with you today. I'm joined by my colleague, Joanna Lowen, to talk about the Irving Harris Advocacy Award and its 2021 recipient, Dr. Jamila Taylor. Our founder, Irving Harris, worked with HealthConnect One in 1996 to help design, implement, and replicate the community-based doula model, a model which recruits and trains doulas within the communities they are serving. And the foundation has supported the organization's work ever since. HealthConnect One takes a holistic approach and partners with communities in an intentional and respectful way through their programming and training to advance equitable, community-based, peer-to-peer support for pregnancy, birth, breastfeeding, and early parenting. Over the years, HealthConnect One has evolved into a national leader working to address inequities in birth experiences for Black, Brown, and Indigenous communities, and to eliminate racial disparities in maternal and child health. The Irving Harris Advocacy Award is given to individuals and organizations making an impact on maternal health and birth equity. And we are thrilled that HealthConnect One is recognizing Dr. Taylor for her leadership, advocacy, and research in the field. I'm going to turn it over to my colleague, Joanna, to talk about Dr. Taylor and her work. Thank you.
Thank you, Denise. Hello, HealthConnect One family. I'm so happy to be a part of this year's wonderful Birthing Hope event. My name is Joanna Lowen, and along with my colleague, Denise Castillo de Isola, I'm here to represent the Irving Harris Foundation. It's our distinct honor to be asked to help celebrate this year's recipient of the Irving Harris Advocacy Award. I've had the extraordinary opportunity to count Dr. Jamila Taylor as a colleague and a collaborator for close to a decade. Her steadfast and visionary leadership is helping to guide this country as it builds a better world during what we all hope will prove to be a period of deep reckoning and repair. Dr. Taylor's combination of truth-telling, policy chops, and optimism are changing the debate, making the impossible seem truly possible. We've seen greater understanding of the devastating impact racism has on maternal and infant health, building real momentum for change. The work required for undoing this harm is a significant task, one that calls all of us in. Dr. Taylor has linked arms with many, and together she and her partners are doing the collective work, bringing the voices of those most deeply affected by the maternal mortality crisis to the forefront, and championing the changes we must make as a country to finally achieve equity, justice, and peace for pregnant and birthing people. Please join me in deep gratitude and celebration as HealthConnect One presents its 2021 Irving Harris Advocacy Award to the esteemed Dr. Jamila Taylor.
Hi, I'm Jamila Taylor, Director of Healthcare Reform and Senior Fellow at the Century Foundation. I'm also a mom, auntie, friend, daughter, sister, and fierce advocate for addressing Black maternal health. Thank you to HealthConnect One for this esteemed honor of recipient for the Irving Harris Advocacy Award. Addressing America's Black maternal health crisis is not an issue I take lightly. Since learning about the high rates of maternal mortality and morbidity among Black women years ago, I've worked to do all I can to use and leverage my expertise in service of saving Black women's lives. I've been able to work with fearless birth justice advocates from across the country. I've interviewed moms who lost their healthcare coverage, all while grappling with the realities of increased risk for poor maternal health outcomes. I've advised members of Congress and other elected officials on policy solutions to address Black maternal health. I've conducted research and written numerous articles and reports. I've responded to media requests, and more recently, I had the honor of testifying before Congress. And yet, the work is far from over. I won't stop until we've addressed America's Black maternal health crisis once and for all. This means dismantling structural racism within the healthcare system and broader society. It means ensuring access to affordable, quality healthcare for women and families of color. It means advancing economic equality and eliminating the racial wealth gap. It means affording Black families the ability to thrive and live free from violence. And it means holding healthcare providers to the highest standards in the provision of respectful maternity care. The list goes on and on. I look forward to continuing this important work with all of you. Today, I pause and celebrate this esteemed honor. And tomorrow, I get back to work. Thank you again to HealthConnect One for honoring me with the Irving Harris Advocacy Award.
Hello, my name is Aisha Robinson. I am a current board member, and I'm excited to share with you about my connection to HealthConnect One. My journey with the organization exists on both a personal and professional level. I first came to learn about HealthConnect One a few years ago when I worked at UCAN. We worked closely with HealthConnect One to develop a first of its kind doula program for pregnant and parenting teens in the Teen Parenting Services Network. The program supported teens who would have ventured through pregnancy, silenced by fear, to ask healthcare providers questions to ensure their needs were met. Teens who may have otherwise birthed their babies without a support and sometimes alone. I witnessed firsthand young moms becoming empowered in their care and watched their pregnancy and birth experiences shifting in a positive direction because of the relationship and the care that they received from their doulas. Personally, I connect to HealthConnect One's mission because I am a mom to a beautiful baby girl, Naima Joy. I'm a mom. I am a Black mom. I know and understand that intersection of my identity can mean inequitable experiences and outcomes for my health, my birth, and my baby. HealthConnect One is on the front line, championing change and working to be agents of that change on a daily basis. They are working to create shifts to establish an equitable new reality for moms like those teen parents and moms like me. I invite you to join me in making a commitment to this mission through your giving. Your support is an investment in leveling the field and improving maternal health outcomes for all babies, for all moms. Thank you.